Hello, and welcome to this session. Improve outcomes, drive growth, boost experiences, all great things that we think we can do with a pragmatic, revolutionary CRM in the payer space. So excited to dive into it with you. Jumping forward, we're going to get a few big takeaways from this session over the next 45 minutes. Really thinking about the hallmarks of a pragmatic roadmap for CRM. And I think probably most importantly, thinking about how plans are using CRM as a decision engine and as a source of intelligent automation to enable a pretty wide range of use cases that turn data into reliable, actionable insights for the organization and allow you to act more quickly. And critically, we're thinking about this and want to have the lens that we'll talk about in a minute that CRM in the payer space can very quickly expand well beyond traditional marketing use cases. And hopefully that will be one of the big things we take away from this together. So quickly, I'll introduce you to who we have on the line today. There's myself. I'm a Director of Digital Health Strategy at Proficient. And I'm joined today by Michael Porter, who's a principal in our Digital Healthcare Solutions group. And he is a chief strategist for CRM and data for Proficient. So given what we were just saying we're going to talk about, he is the go-to guy. And he and I spend a lot of time thinking about what the future of CRM in the payer and the provider space is. In case you're not already familiar with Proficient, we are a global digital consultancy, transforming how the world's leading enterprises connect with their clients in more meaningful ways and really drive superior business results. Our clients demonstrate their trust in us by partnering with us again and again. We are incredibly proud of one particular number in there. They're all fantastic numbers. One particular number in there, which is our 90% repeat business rate, because that number highlights the trust and collaborative culture that we work so hard to build every day with our teams and with each of our clients. Our dedicated healthcare practice is comprised of experts who understand the unique challenges facing this industry, the provider, payer, and life sciences across the board, many of whom come from the payer or provider space. We are trusted by 9 of the 10 largest health systems and by the 10 largest health insurers in the US. Modern Healthcare this year recognized us as the 4th largest healthcare IT consulting firm and the 9th largest management consulting firm in healthcare. A lot of the things that we're going to talk about today are ways that we can leverage pieces of information we have about all of our stakeholders, our consumer base, our member base, our provider and broker and agent base, and the ways that we can leverage in a sustainable and compliant way some of the insight that we can deliver and how we use CRM to do that. It's the focus of the session today. Just real quick, thinking about CRM for payers and some of the things that we want to try and bring out as themes, and then I'll pass over to Mike. We talk a lot about each of the big numbers and big statements here. 360 degree of stakeholder and business health. I think what we want to demonstrate from this is that typically we've often spent time thinking about a 360 view of the consumer and thinking about very marketing and front end, top of the funnel kind of use cases for 360, for a patient 360, for a member 360. We're thinking about it very broadly and thinking about all of those stakeholders and a 360 view across all of those stakeholders. That's a kind of a key piece. We joke a little bit around, can we really ever get to a point where you have 100% value derived from your data? But it's the goal. The goal for this conversation is to say, you know, each of the interactions in an increasingly digital environment generate potential for new insight, not just in the primary use of that data, but in secondary environments where we draw metadata and draw insights and inferences from activities and use those to drive campaigns, to drive better internal knowledge management, et cetera. So that's what we mean when we're saying a goal of 100% value derived from your data. And then in the middle there, really thinking about how AI and machine learning can enable and codify and start to kind of bake in that decision making inside of the organization. And again, there are various places that we can play through that, but the lens that we're taking to this is thinking about how CRM as a platform can be a game changer for the organization when you think about those kinds of goals. So that's the goal here, setting us up for a big discussion. Mike, you want to start talking about some of the use cases that we'll be talking about?
Yeah, absolutely. So we want to focus specifically on the left-facing side. Obviously, you can use it for the patient-facing, but when you think about patient and provider or member-facing, what we're talking about from a CRM perspective is you can use it for a variety of things. A lot of people hear CRM and they think only sales automation, or they think only service center or customer service or call center or whatever you want to call it. But really, there's a lot of things going on with CRM for payers. It's marketing communications. Of course, you're going to do it in the call center. Of course, you want a 360-degree view of your consumer. But for those payers that actually have part of a payer slash patient providing model or provider model, there's things like practice support advisors that go from clinic to clinic. You can't forget physicians. A lot of the payers we're talking to today, physicians keep on bubbling up as a key constituency, and so you want to be able to help physicians be part of your system, give them a great experience, keep them inside of that, but also ensure that you've got everything up to date with that. The same goes with common utilization and care and disease management scenarios. You can put these packages on top of CRM solutions and get a lot better output and outcomes in terms of that. And then finally, of course, it's broker management and lead to quote to card. Brokers are always important as part of the sales process. It is part of the sales process. You do want to ensure that the brokers can work with you and that you know what business is coming in, but you also want to be able to manage the brokers themselves. And that's why we talk about broker management. It's part sales, it's part the actual management. You'll probably have a web portal inside there somewhere. And then finally, it's lead to quote to card. It's the automation. What do I do when I get to a quote and someone says yes, and how do I use CRM to be able to make that better? We'll dive into more detail on this, but if you want to move to the next slide, let's now talk about some commonalities or why it actually matters. If you look at this, you might say, Mike, why are you using a digital set of detail and data? And the answer is that this type of detail and data that drives what you're trying to do with your members. It's about consumers' digital adoption, right? 664% of patients, and therefore members, of course, use a digital device, and therefore when we're talking about an experience and CRM is part of that experience, we want to make sure that we're interacting with digital in that or in mobile in that manner. The same goes for transparency. You want to be able to say what's happening with me and why, and also with dissatisfaction. And really, that dissatisfaction and the silos, those are two key elements, right? Consumer experience is a key element, and members and patients are unsatisfied with what's happening. They want to be able to get a better experience, and they want those in the healthcare world to create a better set of experiences for them. And then, of course, there's the silos. And we see that. We see that in every payer and every provider that we go to. Everyone's frustrated. They want to get past the silos, but they also recognize that they probably have some institutional and technology issues that get past them. CRM as the center of, name that constituency, as the center of your provider experience, as the center of your broker experience, as the center of your member experience, can help you get past there. It's not going to be the end all be all, but it's a key part of that entire puzzle. So David, tell us a little bit more about what we're doing and why.
Sure. So I think you kind of hit some of this already, but to a couple of slides here just to make some big, bold statements that drive a little bit of the detail we're going to go into. Firstly is consumers, and I would say users, desire seamless journeys. So not experiences that fragment as they move between environments in the patient and member setting, between environments and between episodes of care. But then if you think about that broadly, seamlessness is about breaking down the silos inside of organizations as well. And that's one of the angles that we're going to be talking about a lot here in thinking about CRM in a broader way. So think about seamlessness, what it literally means, breaking down some of those silos and edges between experiences and between data sets. And then if you jump to the next slide, I think this is one of those quotes that I think really helpfully kind of sets the goal for a lot of what organizations like Proficient are spending our time helping our clients with. So the evolution of healthcare will be characterized by a re-engineering of clinical care and operations around digital health, and pervasive real-time use of data and advanced analytics. So all of the things that we're going to spend some time talking about, and what I would like to set you up for, help folks who are listening to this and watching this, we're going to take that thought and break it into a series of functions within a typical payer functions, and think about how CRM can revolutionize and create new capabilities and new use cases within that functional area. So again, thinking pervasive real-time and use of data and advanced analytics. How does CRM enable that in spaces in the payer operations beyond just marketing use cases? So if we go to the next slide, what we're going to be doing here is just to orient you to the conversation for the next little while here, is that we're going to be thinking about each of these use cases, talking a little bit about what we mean, talking about what some of the CRM impacts are and outcomes, and then a little bit also about data and integration considerations to achieve and deliver some of those. So this gets back to that the other goal that we had up front of bringing you a pragmatic way to think about our roadmap for these activities. So thinking about broker management, and structurally, we've kind of laid these out loosely in the life cycle journey of a payer business model. But in terms of broker management, so we know that brokers are, a critical part of our stakeholder group. We're all constantly trying to give them better tools to help them sell, help them get training on what the plan offers, and how to better interact with you as an organization to get the most out of the business opportunity that you both have, thinking about their book of business, etc. From a CRM standpoint, and we're intentionally trying to think here not just about the basic kind of functions of CRM in terms of managing the contact, as it were, but what else does CRM potentially provide in the broker management space? And we think that there are opportunities to drive a more automated way of helping brokers and getting involved in their processes in that selling process, giving them better enrollment tools or access to talk to potential customers as they're about enrollment tools, helping them with ever more complex compliance training and tracking, and then, like we talked about a minute ago, 360. So, but 360 from a 360 view of the broker, helping them have a 360 view of their book of business with you, helping you have a 360 view of your relationship with that broker. So those are kind of the target goals here. But Mike's the expert. So Mike, what do you see as some of the expected outcomes from this, and some of the kind of data and integration considerations?
Yeah. So from that perspective, expected outcomes, you expect better broker retention, right? Brokers are a key constituency, and you want to be able to both manage their book of business together, but you also want to create a better relationship. You want to improve that relationship and therefore improve broker retention. You want a better understanding of what business that they're doing with you and where they are in that process. As we talk to a number of our clients, they tell us that they don't understand what the brokers are doing and how they're doing it as it pertains to their book of business. And also, you want the lower cost to manage the brokers. Now, that begs the question in terms of, if I do broker management from a CRM perspective, what's expected? What kind of integrations occur? And in this particular example, when you start off, especially because it's the start of the sales cycle, there's relatively light integrations, right? You need to set them up, you need to get them going, but they're creating the data for you. However, as you move across and you begin to get deeper into it, you might have, for example, quote management. And if you're doing quotes or providing automated quotes for things like individual and family, Medicare Advantage, or even small group, then you might have to get quoting engines in there, and you might have to be able to do a little bit of integration from that perspective. And then finally, once you get to a sold anything for any of your lines of business, you may begin to create, from an enrollment perspective, integrations where you're sending some of this information and kicking off these types of processes.
Awesome. So I think we should group together the next one. We'll come back to a couple of questions there. So if we jump to the next slide, Mike, thinking about sales from an internal sales perspective. Some of the same kind of themes here, being able to enable your internal sales to better pursue and manage and track and have insight into their pipeline, help convert faster, and a lot of process automation. From a CRM standpoint, it is really about additional tools for managing and tracking those large group sales, and you mentioned being able to bring quote engines and etc. from within CRM. And here now you're thinking about a different concept of 360 view in terms of thinking about a 360 view of a given account or group card, that kind of perspective. What similar kinds of considerations here, I suspect. Is that accurate?
Yeah, I think so. There's a lot that can come out of this. And it's important to think in terms of what the sales want and what they're doing, but also to think in terms of who am I selling to them? How do I make CRM become this becomes the first part of that journey for your customer? But if you do it right, you create the first part of a journey that gets a great experience, and that's increased conversion rates. You know what your book of business is. You're able to sell. You're able to stay on top of it. But also it becomes a better way to create account and group satisfaction. They know who you are, you're keeping up with them, and you're doing what they need to do. And just like broker, in this side of things, it's a relatively light integration. A lot of things that you want to do as you get into the enrollment side, and that's actually in the next slide, we'll talk about what it means once something's actually sold.
Okay. So, like you said, we're going to dive into enrollment, and here things get as you move into deeper in the life cycle. Obviously, there's some other broader integration considerations, obviously, but this obviously enrollment, we know that's all around onboarding, but I think some of the things we're going to talk about here is how CRM allows you to, or plays a role in allowing us to communicate better to individuals and families and to groups where they are in the process, and even allow some automation as well. Thinking also about from a CRM perspective, I think one of the things that certainly I hear a lot from clients is, how do we do more effective reporting on each sold policy to really understand where we are with that policy and what the life cycle is, etc. So tell us some of the outcomes here, and in particular, I think you're going to tell us a little bit about how there is more complexity to enabling CRM in this kind of use case.
Yeah, absolutely. And I want to highlight, when you talk about CRM when it comes to enrollment, CRM is not the end all be all. That's not what we're trying to say here. But what we are trying to say is there are some challenges. And when we've interviewed people and they've tried to use CRM to help with this process, what they're usually saying is our current process is okay, but it's email driven. We don't know what's where. We don't know when it's there. We don't know how long it will take to take the initial spreadsheet of all these members and put them through this entire process, so that on January 1, they're ready to go, and you've got everything ready to go. They're set up in the portal, they're set up with the claim system, and so on and so forth. And so really what you're trying to do is make it better. It doesn't necessarily ensure that the CRM is the end all be all of the solution, but it is the glue that ties things together. And if you do it right, then as you're automating some of these workflows and whatnot, you of course can expect a lower rate with enrollment. You can expect that the process itself to move on quickly. You can do more. You become more productive. And of course, there's the reporting. One of the elements that we heard sales talk about was, I get asked, where are we with, and I can't give an answer, or I have to go and talk to 5 different people to get an idea of where we are in terms of each of these systems of what we're doing. And so that reporting becomes much more automated. They get an answer, they get it quickly, they can get back to the account or group or whoever it is and work through it. Now, of course, you can either do it light, pure workflow, or from an integration perspective, now you can talk about, maybe I start sending off messages and information up to claims systems, enrollment systems, benefit systems, and even materials fulfillment vendors when you get to that card part of that and the materials that it goes through. Anything that you can do to make the process easier, especially because this is something that occurs again and again, and especially in the fourth quarter, it's something that you have to do quickly, and you have to do for a whole lot of people, whether it be a renewal or a new side. So that's the idea there.
So CRM effectively kickstarts a better approach to those steps in the process, right? So you get some insight from it, and you're able to kind of go back and do a more effective job in different steps as well. So there's its direct usage, and then it's usage as a source of insight to continuously improve enrollment, find gaps, find holes, etc. Right?
Exactly.
All right. So, kind of taking a jump to another part of the organization, then, and a different set of considerations, but same kind of great opportunities if we do this effectively. Thinking about network management and managing physicians and their interactions, their many interactions, many provider interactions with us. So the concept here, similar to what we were talking about with enrollment, similar to what we were talking about with brokers and sales, is leveraging CRM not just as the contact management or that basic relationship management, but thinking about how you understand your physician your providers from a 360 perspective, and vice versa. But then also, how you allow for more effective automation of onboarding, automation of credentialing, and integrations with credentialing systems, which I'm sure we'll talk about. And then also, I certainly hear this a lot from clients as well, organizing key tasks and really critically understanding where providers being able to understand where they stand with regard to key tasks, and visualizing some of that. And your thought is that CRM gives you a bunch of options in terms of making those experiences more rich, drawing more inference from them, and kind of the same kind of continuous improvement opportunity there as well.
Yeah, and this is an interesting thing. When we talk CRM, everyone expects it to be member, but what we're seeing is a commonality among a lot of our health insurer clients is that physicians keep on coming up again and again and again. And I think it's because they're beginning to recognize that the experience they're giving physicians up until this present point in time, whether there be small, medium, or large health insurers, they're not doing enough. And what they're doing is completely siloed. Here's my process for contracting. Here's my process for onboarding. Here's my process for credentialing and re-credentialing, and so on and so forth. And you may have the same team, they're not working off a common set. They don't have any automated processes. They don't have any ticklers that goes to do that. Everything can be manual. Now, it's not the same for every single one of our clients, but it's amazing the amount of silos and the amount of manual work going on. And what you see, and we're seeing quite a lot, is that from a network management perspective, they're beginning to migrate to CRM and packages on top of CRM to be able to do that. And there's a lot of benefits, especially the automation, knowing what's going on and making this better, which brings that lower cost to manage your network and, of course, higher physician satisfaction. And they are looking for higher physician satisfaction. From a data integration perspective, a lot of this is all about how do I automate these things? And credentialing itself, when it comes to that, that's where you're trying to create interactions with other systems that are part of that credentialing process. And what we're also seeing is that in some cases, CRM may actually store the document, it doesn't have to. But in a lot of cases, they already have contract systems or document repositories where said contracts are taken. And now what you're saying is as part of this process, especially if you're integrating to a portal of some kind, because the physician portal is where they begin to interact with all these things, then you want to make this into a nice trifecta of those systems so that as they upload documents, those documents go where they need to go and become part of that overall process.
Awesome. All right, I really want to stay there, but we'll keep going just for time, because each of these use cases is really interesting. I think call center is one that's kind of pervasive across industries, but I think again is one that this is an area where I certainly see a lot of ask from our clients, both in the payer space and the provider space, but CRM, the goal here, the vision is building data intersections that enable those tools to be in the hands of CSRs to give quicker answers to members or to anyone calling in, to drive call efficiency and deliver beyond expectations. And here, like the other four we've spoken to, CRM is obviously a kind of a coordinating tool, but also a kind of a knowledge curation tool as well, and has that potential role as almost a kind of a multi-channel campaign checkpoint, because of the number of data points that you can start to gather from people calling into a call center, and both use CRM to deliver knowledge out in the most effective way, but also, again, as a source of gathering new insight about what call center behaviors are, what kinds of things we're trying to solve. So what are your thoughts on outcomes? And again, same kind of process, outcomes and data and integration when it comes to call center. What are you seeing?
Yeah, absolutely. Before talking about outcomes, I want to highlight one thing. Call center is one of those no duh type of things. You know, you obviously expected CRM, some kind of service center, to do this, both for member calls and physician calls and even other calls. And that's a key element, but don't forget that there's an ongoing evolution. What about our next best action? When someone calls in, what are we trying to do? That's what we're talking about, new behavioral data pattern insights. Really what we're saying is, how do I get an insight and move it into an action? When someone calls, there's a time for an action. Did you know that? You know, and now all of a sudden you can offer up opportunities to improve the relationship with physicians, with members, et cetera. And of course, there's the typical ROI. We didn't actually come out and say it, but you know what your typical things that you're looking for. It's first call resolution. It's how long am I going to be on the call, et cetera. So those are the expected outcomes, but don't think that just because you're using CRM that you're done. You're always looking for that next best element, the creating a better set of interactions with whoever is calling, and making that experience better. Now, from a data integration perspective, you've got a lot of things going on. Anytime you talk about a customer 360 of some kind, now you've got a lot of integration that you're trying to do. It's going to be claim systems. It's going to be, it's going to be policies. It's going to be things like, what are my thresholds? Have I met my thresholds for the year, et cetera. So there's a lot of things going on from this perspective. The good news, and what we haven't talked about, and if you can kind of see it, is you begin to get economies of scale. Once you've got all the claims in CRM, and that may not be in CRM, but callable by CRM, now you can begin to use that for other things, like what's going to come when we start talking about care and disease management, utilization management, et cetera. So there's a lot of integration here, but one of the reasons we're seeing other elements come into play is because of this becomes the foundational element that drives additional value from a CRM tool.
Yeah, and this is one of those areas where you and I have been on work together, where you provide some of that additional insight into the call center, but you got to be careful you don't give people too much information, right? And kind of cause that kind of that challenge for the end user on the call center side. Totally get all the things you're talking about, but there's that kind of proliferation challenge as well.
That's a great point. The commonality that we're seeing isn't how much information can I put out there, but what is that person who's calling us asking? And based on what they're asking, how can I create the best view to get them to the expected outcome?
Yeah, it's fascinating stuff. So, all right, so we're about halfway through some of the thinking here on particular sets of use cases. As you know, near and dear to my heart is the whole space around care and disease management, and the evolution and revolution that's going on in terms of care delivery and use of virtual tools and on all of those kinds of things is seeing a lot of activity, and something we'll spend a bit of time on in a moment, going into a bit more detail. But the CRM impact here is thinking about how you can use insight around our members and use that knowledge to query and segment members based on their attributes, and start to standardize assessment processes, management processes, and really kind of get our arms around getting the right people into the right programs and getting the right kinds of tools into the right hands of members who can get the most benefit from them. That's the big opportunity here. What do you see as some of the outcomes?
Yeah, and if you think about it, and I take it in a logical outcome, the first thing, and now we're talking about the economies of scale, because you now have access in a CRM to these types of member information, is who do we need to target on this? And if you can get better targeting, and that targeting leads to a great conversation. And everyone does care management, disease management, triage a little bit differently. But the idea is if I can get access to that information and I can use that information to create good queries that lead me to find everyone who has named that chronic condition, name that disease, then you can get to you can get there faster. You become more efficient in what you're doing. And of course, if you're using it, especially when you integrate with these assessments, these outcome-based assessments, they're evidence-based assessments. I'm sorry. Then all of a sudden, as you're talking to them and you do finish the assessment, you know where they are. It's integrated into your whole process. It's part of the same screen that you're doing. Now you're getting to the better enrollment rates. And finally, of course, as you use a workflow and you use these flows to follow to its logical outcome, you get better health outcomes themselves. So there's a lot going on here, but we're seeing some improvements to how this has worked, especially as we begin to implement it there. And what's interesting is everyone's been using CRM for sales in call center, but we're seeing more and more payers who are very interested in this type of outcome, because what you all are looking for is how do I create better outcomes, but also how do I decrease the costs? And these are things that can actually have a direct impact on that. Now, when it comes to data integration, you're not surprised, right? It's claims systems. You might want to create integrations to your EMRs or other things, especially if you have some better integrations with some of your more common providers in the system. You might even be pulling in things like social determinants of health or other demographic information. The good thing about this, when it comes to the CRM, is now you've got a CRM with all of this information, or you even have a CDP with all this information. You pull it all into one area, and you can begin to really get some great outcomes, not just based on claims data, but other information that will help drive your targeting when it comes to care and disease management.
Awesome. I'm going to hold on that and come back to it in a minute. We're going to talk about virtual health in a little bit more detail, but on the utilization management. So, got a couple more. Utilization management. We all know that's that space and that process, and is really about kind of pretty prescriptive set of kind of goals here to drive to meet deadlines and kind of make sure that we're using funds in the right way. And kind of automating functions there to do that, but at the same time making the experience, ever more compelling, or at least less kind of challenging. For it's a tricky process. So how do we use CRM, and what are the outcomes that we use what are the outcomes we think we can see in utilization management, Mike?
Yeah, and this is an interesting one. We're seeing this quite a bit where, and this isn't one way to think about CRM vendors. Name any of the big CRM vendors who are making significant investments in healthcare. Mm-hmm. And I'm specifically being a little bit ambiguous in terms of who these vendors are, but you name these vendors, especially the big three, and you're seeing that investment, but you're also seeing an ecosystem. And the ecosystem is, they have their baseline tool, which includes, health solutions. And all of a sudden you see these people who are saying, I can use the baseline tooling, the workflows, the data model, the integration, and all the things that come with the CRM, the creation of cases and so on and so forth. And they can put utilization management on top of it. They can put care and disease management on top of it. And then they begin to extend it. And that's the key here. What we're seeing is if someone does a care and disease management solution, that same person who's part of now the ecosystem of name that CRM vendor also has a utilization management solution. And this really gets to the core, using the combination of the capabilities of the package on top of CRM and also the core capabilities of a CRM itself. Now you've got the approved ability to meet required deadlines. When it starts, and of course the clock is always ticking when it comes to utilization management. You can get there. You can spend less time managing and more time focusing on what's important, which is, let's look at these records. Let's figure out if we can do it ourselves. Do we need to send it out to a third party? And of course, once you're under deadlines, and once you're trying to do a proper assessment, then it's better understanding through better reporting. And of course, the integration, claims is something that comes up time and time again, but you may be even doing HIE or EMR integration if you're looking to it. And of course, there might be integration to document management or similar systems. There's a lot of, would you please fax that? Would you please email that? You need to automate the system, and you need to ensure that the CRM tool has access to these, because you're trying to create a one-stop shop in terms of what's the experience that these people who are creating that, whether it be the start of the triage, whether it be a nurse practitioner, a PA, or a doctor looking at these things and asking for more information. There's that flow, there's those exceptions to the flow, et cetera. You're going to want to do all of this in order to make a great experience to meet your deadlines.
So a lot to think about in that one as well. So I think just to kind of get us to the last use case here, and this is we deliberately put this at the end. It's kind of happens throughout, and a lot of people think about marketing automation as at the front of the funnel, but this is more of a kind of a traditional CRM role across industries. But I think in the payer world, this is increasingly kind of transformative. And the main thing I take away from this slide is, how do we use the intelligence that we can get from CRM to trigger more carefully orchestrated and using behavioral and derivative data pools to drive more to animate static and uniform journeys. So I think there's a lot of debate across healthcare about how you kind of see the intersect between CRM, marketing automation, personalization. A lot of opportunity in this space and a lot of ways to define it. How do you think about the outcomes for marketing automation in the payer space?
Yeah, there can be some great outcomes. I want to highlight one thing, and that's this. As we've talked to all of our clients, we've had people who are saying, we're at the beginning of this path. We're going down this. We're going to do a great job at, especially with communications with our members. We've actually had some of our clients who have said, "Oh yeah, we're not doing anything with marketing automation. We don't even need marketing automation because we're not allowed to talk to our members, especially using the data you're talking about. We're not going to go and use claims data or other information to actually create a targeted set of communications." And by the way, that's not necessarily correct. Yes. There's HIPAA, yes, there's all sorts of things that from a regulation perspective, you have to be very careful and you have to follow. But the reality is, just like hospital systems and other providers have been able to figure it out and stay within the bounds of the law and not be creepy, got to always figure about that. You too can create HIPAA compliant communications, and it's for a variety of purposes, right? There's core use cases, there's triggers, there's wellness improvements you're trying to do. If you put someone on a plan, well, maybe them being on a specific plan can create an automated journey of communication, and you can actually track what that journey is as you give them reminders via email or you give them reminders via text message. There's all sorts of things that you can do. We've got a lot of people, one common outcome is they want to be able to convert people from large commercial plans to, oh, now I'm retired, let's talk about Medicare Advantage. And the time to start talking about them isn't 2 months before retirement, it's 3 years before retirement. And what's the automated journey that you're going to create that? And we talk about automated journey because it's exactly what marketing automation is. And CRM and marketing automation, and to an extent, an up and coming tool called CDP, all are used to be able to find out who you need to communicate it with, create that personalized journey, and then set that journey off on its path without a lot of human-based manual tasks. Now, from that perspective, that means marketing automation, almost more than anything else, requires a lot of data. They love data. It's all about the data. That's why a customer data platform, a CDP, is starting to come into place, where it's a trifecta of tools. It's the CRM tool. The CRM vendor almost always has a marketing automation tool. And then, of course, there's a CDP, which can come from one or more vendors. And I love to talk technology. I love to go into that detail. But that means that you want to think through scenarios, comment in real time, batch integration, et cetera. There's still some reticence people have in using social determinants of health or demographic information, but you definitely want that. So we can spend a lot of time, but I know that we want to get to some of these use cases. So let's keep going.
Yeah, so I think that was really the majority of the use case stuff that we want to talk about. So the only thing we wanted to leave everyone with was just, as you think about that, there's an approach that we use to getting our arms around this and thinking about a pragmatic roadmap for all of that activity, because there's a lot of change that people are expecting, and it's what we call our now, new, next framework. And the way that we use that is it's a tool for quickly benchmarking and prioritizing your experiences portfolio, your member experiences, your stakeholder experiences. And jumping to the next slide, the thinking here is, you want to spend, it's that idea of spending 70, 20, 10. So you want to spend 70% of your time thinking about things that maintain balance with things that others in the industry are already doing. So fix and enable your table stakes and maintain the kinds of things that keep you at parity. The 20% that you want to be spending your time on is things that are emerging, that some of your peers are delivering, but that you are not, or experiences that you're delivering alongside some of your peers that are trending. And there we're thinking about, you pilot things you haven't tried, or you decide to kind of embellish and expand on things that you have been targeting. And then the next is the stuff that you can be a bit more experimental about, where you're investing and trying to think about differentiating. Just to give that last couple of minutes of our time with you, just to give that a little bit of flavor, we're going to talk about using that platform or that framework in the context of virtual health. So we talked about CRM. We spent a lot of time talking about CRM and the potential value, thinking about virtual health and the explosion of experiences that we've been putting out into the member sphere. What are the ways that we can use CRM to get value out of that? In that now world, it is what we're seeing most payers doing is pretty basic integration of adoption and usage data from virtual health, just to track and tick an implementation box. We put a tool out there, some people are using it. What we're starting to see is virtual health as a new front door for e-commerce beyond just the initial virtual visit, and thinking about how you can track things out of that fulfillment experience that can be used more broadly. And then more innovatively and more future looking, this gets to that whole kind of care and disease management angle here. How do you use CRM as a catalyst to ingest, integrate even just the basic behavioral and adoption data about virtual health usage as a source of insight in its own right? So how can we start to say, because our members are using these tools, what does that tell us about how we can target other activities towards them, how we can help make their experiences more seamless to the point at the very beginning, and how does it allow us to drive towards better outcomes? And I think, Mike, you have a perspective on this from a marketing automation standpoint on the next slide. And I think then we've covered most of the things we wanted to try and cover.
Well, that plus a couple case studies, so we can get to it. So if there's one thing I want to talk about is the now is all about just getting communications out, and the new and the next are all about using the data to create better relationships and better understanding to go from the insights to the engagement. Mm-hmm. And if you want to move on, let's talk about how that's being used by a couple of different people. So there's this nonprofit payer in the Northeast, and this nonprofit payer, they're using the Salesforce platform, but you can do a lot with all of these CRM type tools. And they said, listen, we want to use it not just for customer service. They want to use it for lead to quote to card. They want to use it for care and disease management. They want to use it for the marketing engagement as well. And then also utilization management. And then they're going to start thinking about things like network management. So this is a great case study. It's a case study that's moving on, but they're using this to create these economies of scale for these types of systems. And as a small payer in this, in their world, they have to make sure that every dollar's there. And they've chosen to go with a CRM and then layer these things on top, because they already have that data. They can create these economies of scale. They already know how they're going to do the workflow, et cetera. And Dave, do you want to talk about the next one in 20 seconds or less?
Yeah, 20 seconds or less. This is a large provider system that we did the initial install of CRM. And what was really interesting about this was exactly the kind of thing we were talking about earlier. We helped this organization work through and identify behavioral pools that allowed them to do event-based triggers of campaigns based all the way back into EMR data. So I think the big takeaway, like you said previously, is a lot of folks get frightened off of how you can use those kinds of data points effectively and in a compliant way.
And moving on to the next one. This is the last one, but we wanted to highlight that once you have a CRM in place, it's not the end, right? You always are trying to improve what you're doing. It might be improvement inside of the customer service center. It might be improvement in sales, et cetera. So keep in mind what you're trying to do and how you're trying to get there. From this particular large mid-Atlantic payer, we've worked with them to continue to do a continual optimization, enhance sales, increase productivity, et cetera. So that said, let's move on to the next slide, and thank you for your time. We're very grateful to be able to present this to you. As you can tell, we're kind of excited about CRM, especially because CRM is no longer what people used to think it was. It's so much more than that, and you can begin to really get some value as you think it through like that.
Absolutely, 100% agree, Mike. Thank you all very much.